Migraine headaches can be so severe they can drastically impact your life, causing nausea, extreme pain, and sensitivity to light and sound. Sufferers are typically women in their teens through early 50s. The triggers vary widely: stress, weather, certain smells, or foods.
There are a lot of things going on in the head, so to speak, when somebody has a migraine, but typically we have linings in the brain called meninges, and it's the irritation of those meninges that causes the pain.
But doctors at Spartanburg Regional Healthcare System offer a treatment for migraines that provides immediate relief for many patients.
Well, the name of the procedure is known as sphenopalatine ganglion block or neuromodulation. We just refer to it as SPG blockade for short. It's for the treatment of migraines.
The procedure lasts just 10 minutes. Patients are not sedated. Only a numbing medication is used. Dr. Harp targets a part of the deep nasal passages where a bundle of nerves is located, nerves responsible for migraine attacks.
The procedure is actually very simple. What we do is we take a very small directional catheter and we have the patient lay flat on their back, and we then insert the catheter into each nostril. And what we're trying to do is seek out a bony ridge within the nasal cavity known as the middle turbinate.
What makes this procedure possible is new technology, the design of the catheter, which allows the doctor to be able to reach the nerve bundle with the medication.
So this is the catheter that we use. This is known as the SphenoCath, and it's a very soft tip catheter that does not impart any sort of trauma when we insert it up the nose. You can see it's got a little angle or bend to it, and this angle or bend allows us again to seek out that middle turbinate and again to hook it. We guide the catheter down that middle turbinate. Once we're in that location, we inject a small amount of medicine, let gravity do its job. The gravity takes that medicine to a specific location in the nasopharynx known as the sphenopalatine ganglion. And that is a network of nerves. You can kind of think of it as a junction box like you would have at your house where a lot of nerves are coming in and out. Junction box has a lot of wires coming in and out. And this ganglion or junction box of nerves is one of the ganglions responsible for migraine generation. And what we do is we block that or reset that so that the patient can then have an extended period of time to be migraine-free.
The effects of the procedure vary according to each patient, but can stop migraine pain for months, even years. Innovative treatments by qualified physicians at Spartanburg Regional Healthcare System.